I'm Dr. Stream, a board-certified family medicine and sports medicine doctor. In this video, we're going to discuss how eating too much sugar can cause insulin resistance and type 2 diabetes. Without further ado, let's get started. So before we talk about type 2 diabetes and insulin resistance, let's first understand some basics about sugar. So when you say sugar, basically table sugar, it means sucrose. And the sucrose has two sugar molecules. So we have the glucose and then we have the fructose. There's 50% glucose and 50% fructose. When I was growing up in India, as well as kind of traveling to Thailand and stuff, I was exposed to only table sugar. I was never exposed to high fructose corn syrup. At least as far as I know, I was not exposed to high fructose corn syrup. However, when I moved to the United States, that's when I started tasting the high fructose corn syrup. To be honest, I'm not a big fan of high fructose corn syrup, just from a taste perspective. But still, the high fructose corn syrup also has glucose and fructose, except that there's a little bit of, there is more fructose here compared to glucose. There's 55% fructose and 45% glucose. Sometimes you can have 60% fructose and 40% glucose. But the key here is that both table sugar and high fructose corn syrup, they both contain fructose. There is a misunderstanding among people that high fructose corn syrup is bad, table sugar is healthy. No, they both are equally bad. There can be a debate saying that maybe the high fructose corn syrup is probably worse than sugar, but again, that doesn't make sugar as healthy an option though. Now let us say I eat 3 teaspoons of sugar in a coffee or so. So the sugar molecule is going to get converted into glucose and fructose. So the glucose is going to be used up by the muscles if they're working. So let us say if I'm exercising, or let's say if I'm going to exercise after a cup of coffee with some 3 teaspoons of sugar, then that glucose molecule is being used up by the working muscle. But let us assume that I'm actually sedentary, I'm not doing anything. So what happens is that the fructose, they cannot be used up, they cannot go and directly knock the muscle door. So the fructose goes to the liver and it knocks the liver, door, and basically the liver will let the fructose in, and then the fructose can be converted to glucose, or the fructose can be converted to fat. So the glucose, however, it can go and knock the door on the muscle first and ask, do I have space inside the muscle? So basically the space in the muscle called as the muscle glycogen. And let us say the muscle glycogen is already full. So let us say if you had a really good dinner last night and if you've not done any exercise, then the muscle glycogen stores might be full. In that case, the muscle might say, I don't have space, go to the liver. So then the glucose will come and it comes and knocks the door of the liver. The liver doesn't push away any glucose or fructose. The liver is actually a really good, very friendly organ in our body. So the glucose knocks the liver door and asks, can I come in? And let's say if the liver has enough space in the liver glycogen, which is the storage glucose area in the liver, then the glucose will get deposited in the liver as liver glycogen. But let's say the liver does not have enough space, then the liver converts the glucose into fat, and this fat gets released into the bloodstream, and then it goes and deposits as fat. So we have fat stores, we have subcutaneous fat, which is the fat that is way outside our organs, so basically the fat that we have around. And then we have a visceral fat, which is the fat that is kind of surrounding the organs. So in order for all this to happen, we need a proper insulin secretion from the pancreas. So let us say if someone has insulin deficiency, so let us say if someone has type 1 diabetes and they're not taking insulin, and if they have insulin deficiency, then this glucose, they cannot get deposited in the muscle or liver or fat. They just kind of circulate in the bloodstream and thereby causing complications from high blood sugar. So let us say if someone has severe insulin resistance, again, the insulin is not able to help the glucose go and like knock down the muscle, liver and fat. Again, that will eventually result in high blood sugar. So the main action of insulin is to make sure that the blood glucose stays between 70 to 140. So let us say if you're starving, let us say if you're not eating at all, then our blood sugars might drop. So in that case, the stress hormones such as the cortisol and the glucagon, they go and knock the liver and say, we need some blood glucose here, and the liver will start to pour the glucose into the bloodstream and thereby trying to keep that blood sugar between 70 to 140. But let us say once the blood sugar runs more than 140 or 150 or so, then the insulin will come and tell the liver, hey, stop producing excess glucose into the bloodstream, and then thereby the blood sugar stays between 70 to 140 all the time. However, let's say if you eat sugar here and there and still exercise regularly, then you're using up the glucose and fructose and not turning them into fat. However, if you spend less energy and store more energy, then the problem starts. Now let us understand how insulin resistance and type 2 diabetes develops. Let's see how a person actually develops type 2 diabetes. So in type 2 diabetes, there's actually insulin resistance. So I'm going to run through a scenario just to have a better understanding of this concept. So let us say I drink milkshake which is loaded with sugar. Once I drink that, my blood sugar starts spiking. My body immediately senses that and it starts producing insulin. The goal here is that it wants to make sure that the blood sugar doesn't spike more than 140. Unfortunately, our body doesn't exactly know how much insulin it needs to produce. All it does is that it wants to make sure that the blood sugar doesn't spike more than 140. So there's a big push of insulin that happens in your body. So the insulin tries to bring the blood sugar down, and sometimes it overshoots the insulin secretion that causes the blood sugar to drop down. And then immediately our stress hormones, predominantly our cortisol, and the other hormone that we talked about is the glucagon, they start to again elevate your blood sugar to back into the range, that is the 70 to 140. So when this happens, our body starts to understand something, right? So now our body starts to create resistance to insulin. Why is that? So think about this. Let's say if someone slaps you, and obviously you feel the pain, right? But let's say if that person is going to slap you every hour, right? After a few days, it's probably not going to hurt you like it was hurting you the first time when you got a slap. So what happens is that you start to create resistance for the pain so you don't feel it. So that's what every smart person will do, and that's what happens in our body too. So now our body says that, you know what? So he's probably eating too much sugar. I don't want my blood sugar to drop quickly, so I'm going to create some insulin resistance. So this way, when the next time when he eats something, even though if I produce too much of insulin, there is a little bit of resistance to insulin, thereby not too much of insulin acts right away to get the blood sugar back into control. But imagine you keep doing this every day. You keep drinking chocolate milkshake every day. You keep eating high sugary foods. And then eventually your body starts developing insulin resistance to the point where you start needing more and more insulin. Okay, so that's one scenario. The other scenario is that we talked about how when you eat excess amount of glucose that is not being used for energy, the excess glucose gets stored in the liver, muscle, and fat tissue. But again, these are all stores in your body. I mean, after these stores are full, the excess glucose cannot get stored in the storage areas. Initially, what happens is that, so let's say the glucose goes to the storage area and it kind of knocks the door and says, you know what, I want to come in. And then the storage area, such as the liver glycogen and muscle glycogen, says that, you know what, we are full, just go back. What does the glucose do is that they go and complain to the organ pancreas where the insulin is being produced, and the insulin comes and then they basically force the glucose into the storage areas. Eventually, what happens is that these storage areas starts to put more and more barricade, or like more and more gates, and then it starts to become more and more harder to push these glucose into those storage areas. So there's a point where the organ pancreas is unable to overcome the resistance created by the storage areas. Then you start to develop increased blood sugar, and that's when you start developing type 2 diabetes. So when you analyze closely, you'll find that the patient has high blood glucose, but they also have high insulin levels. But let's say if you take a type 1 diabetes, they have high blood glucose, and but they don't have enough insulin. So then this patient comes to the doctor and says, you know what, my blood sugar is high, and then we started prescribe medications. Not all medications actually increase the insulin levels, but certain medications do, and this actually worsens the insulin resistance. And after that, once things go out of control, then we prescribe insulin, which actually worsens more insulin resistance. But we know clearly that high insulin levels can be bad for your body. So does this mean that insulin is bad for type 2 diabetes? And the answer is it's no. So remember, without insulin, type 1 diabetes patients may not survive. But in type 2 diabetes patients, yes, there are high insulin, but the high blood sugar is also a big concern, and this is an urgent thing that we need to start treating right away. So when someone comes with a high blood sugar, that high blood sugar sometimes causes inflammation of the pancreas, and the pancreas is not producing any insulin at all. So during this time, I prescribe insulin. Again, it depends on a case-by-case basis. Sometimes I don't prescribe insulin. I might just get away with just diabetes medication. in some patients, I might have to prescribe insulin, but then the goal is to get that blood sugar under control. So once I get the blood sugar under control, then we focus on lowering the insulin at the same time lowering the blood sugar. And that's going to happen by focusing on these 4 things: regular exercise, healthy eating habits, and again when we say regular exercise, it includes both aerobic and strength training exercise, avoiding stress, and ensure that the person has a proper sleep. So recently I had one of my patients called as John. He actually was able to reverse his type 2 diabetes. We started him on medications first, and then slowly we implemented all the healthy lifestyle changes, and we were able to reverse his diabetes. So if you want to know about his story and how he was able to reverse his diabetes, then watch this video here. You will get a lot of helpful tips by watching this video so that you can use that to help your diabetes. Okay, so I hope this video was helpful. If you have any questions or concerns, please post in the comment box below. If you really enjoyed this video, if you found this video helpful, please make sure that you hit the like button so that this video can reach more people. Okay, and I'll see you in the next video. Until then, goodbye.